Hey guys, today I want to talk about gastrointestinal diseases. Now, when we talk about gastrointestinal diseases, we basically refer to diseases involving the gastrointestinal tract, right? Namely the esophagus, the stomach, the small intestine, and the large intestine. And also don't forget our accessory organs, right, of digestion, which includes the liver, the gallbladder, and more importantly, the pancreas, right? Don't forget that that's part of the GI system too. Now, let's talk about a few diseases that we might encounter in our exam, and that would include Crohn's disease and ulcerative colitis. Now, those two are major NCLEX diseases, so make sure to take note of that. Okay? Now, let's begin and go over Crohn's disease. Now, with Crohn's disease, it's what we call an inflammatory bowel disease or IBD, right? Now, what it basically means is that it can affect any part of the gastrointestinal tract from the mouth all the way down to the rectum. But with this disease, it specifically usually affects primarily the small intestine or the ileum, right? Now, now the symptoms with our patient can include abdominal pain, and this is very important because what do you know what the reason is for this pain? Basically, it's due to the inflammation, right, of the lining within the digestive tract, which obviously can lead to abdominal pain. And and keep in mind, be mindful that this inflammation can also lead to severe diarrhea, which can be bloody, right? And with all these complications, it leads to fatigue and weight loss to our patient. Therefore, the symptoms, like I mentioned before, can include abdominal pain, right, due to the inflammation. The patient can also have severe diarrhea, which can be bloody, and the patient will be fatigued and can have some weight loss. Okay? Now, remember when I mentioned that it affects primarily the small intestine or the ileum? Now, this basically means that the pain would then be manifested as a lower right area abdominal pain in our patient, right? Again, since it affects most commonly the small intestine or the ileum, therefore a major symptom for a patient with Crohn's would therefore be a lower right area abdominal pain. Okay, so make sure to take note of this because this can be very important information for your NCLEX exam. Now, there are no medications or surgical procedures that can cure Crohn's disease. Okay, I repeat, there is no medications or surgical procedures that we can do to cure our patient with Crohn's, but there are treatment options. Okay, there are treatment options that can help alleviate or lessen the symptoms and hopefully maintain remission and hopefully prevent relapse in our patient. Now, important treatment information that you have to know would include giving your patient anti-inflammatory agents or basically anti-inflammation drugs, right? Now, the goal of this treatment is obviously to control inflammation, right? Since less inflammation leads to a relief in our patient's symptoms such as the abdominal pain, right, which can hopefully decrease the diarrhea and the rectal bleeding too. Now, a common drug that you might encounter in your exam would be sulfasalazine, right? And again, it's an anti-inflammatory agent. And the side effects can include nausea and vomiting and some gastric distress. And this is because it does react with the stomach lining with our patient, okay? Now, corticosteroids such as prednisone can also be given to our patient, and corticosteroids in relation to Crohn's, what it does is it basically suppresses the immune system, and the immune system responds in the body, which in some way plays a role with the inflammation. Okay, now I will go over other important topics and other diseases in the next few videos. Now, I want to thank you so much, guys, for spending your time. I really do appreciate it, knowing that you have learned something that can help you hopefully pass your NCLEX. And if you do feel that you want to help support me with continuing doing these videos, just please visit me in my website at www.allnursingnotes.com. Again, that's www.allnursingnotes.com. And there's an NCLEX course in there that's available that has helped hundreds and thousands of NCLEX takers pass their exam. And again, thank you so much for your time. I wish you the best of luck in your exams. I know you will do great. Thank you and God bless. Bye bye. Hey guys, when taking your NCLEX exam, you will stumble upon at least one of the inflammatory heart diseases at some point. And I guarantee this, the thing about cardiac diseases, especially inflammatory uh, diseases, is that we don't really fully look at the diseases as a whole, or at least trying to make a connection between each disease to fully understand the bigger picture. Because when we do look at the whole picture, it's easier to simplify the differences and the correlation between the inflammatory diseases. Now, first, let me ask you this. Do you know what inflammatory heart disease is? It's basically it basically pertains to the inflammation of the heart muscle, right? Which is usually due to an infection that develops from either a bacteria or a virus. Now, take note that this type of inflammation is often associated with episodes of rheumatic fever, right? And another one is a big one is Kawasaki disease. Now, those two are very important to know for your NCLEX because those two diseases, if untreated, leads to inflammation of the cardiac muscle, right? And the cardiac vessels. And it's a very, very bad thing. Now, the three inflammatory conditions that you might mostly encounter in your NCLEX exam can be classified as either pericarditis, myocarditis, and endocarditis. Now, first, let's go back to our anatomy because this can help us understand these conditions in a more simpler way. Now, the heart wall is comprised of three layers, right? The outer epicardium that covers the pericardial layer or the pericardium, right? The middle myocardium layer, and the inner endocardium layer. So it's important to mentally distinguish between the pericardium, your myocardium, and the endocardium layers of the heart wall. So again, the pericardium is the thin layer of connective tissue and fat and serves as more of like the layer of protection for the heart, right? And it's the outside layer. Under the pericardium is the myocardium, which is the muscle tissue of the heart, and it's usually composed of the cardiac muscles, right? And these muscles contract, and the conduction of electricity coordinates with the contraction, right, for the muscle. Now, lastly, the inner layer or the endocardium, right, is composed of endothelial cells, and it's also composed of the smooth muscle of the heart and the vessels that connects to the valves. That's why when we talk about an endocarditis infection, it is sometimes referred to as an infection of the heart valves, right? So again, a good way to remember this is that the pericardium is the sac or the outer layer, the myocardium is the middle layer and is also the thickest layer, right? And lastly, our endocardium is more of the inner layer and basically acts as a barrier between the blood and the heart muscle. Again, with that in mind, we can simplify this even more by saying that the pericarditis is an inflammation of the pericardium, which is the sac surrounding the heart, right? Myocarditis is an infection of the heart muscle, right? Because since it's the inner heart muscle, right? And lastly, endocarditis is referred to, like I mentioned before, an infection of the heart valves, right? So that makes everything more simple and more easier to remember. Now, I want to quickly go over important things to remember for your NCLEX exam. Now, one of the ways to diagnose our patient for potential pericarditis is assessing our patient for pain, right? But the problem with that is pain can usually also be associated with other conditions, right? So, one of the more important symptomatic assessment to diagnose our patient with a potential pericarditis is basically by looking for what we call the pericardial rub. Now, a pericardial rub, right, or it can also sometimes be called a pericardial friction rub, can be detected by obviously using a stethoscope, and basically it's a sign of inflammation, right? So let me simplify more. Upon doing some auscultation with our patient, there is basically an extra heart sound, right? Aside from the typical systolic and diastolic, there would be an extra diastolic sound. So therefore it becomes a three-component heart sound, right? Which means it would be a one systolic and two diastolics. Now, some textbooks would say that it resembles the sound of a squeaky leather, and sometimes it's also described as a grating, a scratching, or a rasping sound, okay? Now, this is it for now. Again, thank you so much, guys, for spending your time with me. I really do appreciate it, knowing that you have learned something that can hopefully make you pass your NCLEX exam. And if you do feel that you want to help support me with continuing with all these NCLEX videos, just please visit my website at www.allnursingnotes.com. And there's an NCLEX course in there that's available for everybody, and it has basically helped plenty of people, thousands and hundreds of NCLEX takers pass their exam. So again, thank you so much, guys, for spending your time with me. Good luck on your exams. I know you will do great, and God bless. Thank you.